Now sounding the alarm about a dramatic rise in addiction to opiates like oxycodone in our borough. And News 12 The Bronx reporter Sloan Glass is at St. Barnabas Hospital to talk about new resources that could help combat the problem.
According to the New York City Health Department, one New Yorker dies every other day because of opioid painkillers. And the health department says that Bronx residents have the second highest death rate due to opioid overdose among the 5 boroughs. Concerned doctors say that patients are underestimating the deadly dangers of drugs like oxycodone. And they hope this new kit, which includes clinical tools and an app, will benefit the Bronx.
Our advice to healthcare professionals is use opioids when they are needed to help with pain from things like a broken bone or surgery, but to not use them any longer than is really needed.
What we need to do is to really educate all physicians, both at St. Barnabas and throughout the Bronx community, about what the alternatives to opiates might be.
Dr. Edward Telzak at St. Barnabas Hospital tells us there are alternatives to prescribing opiates, and education can help both healthcare professionals and patients stem the epidemic. At St. Barnabas Hospital, Sloan Glass, News 12, The Bronx.
Welcome to this edition of City Health Beat, the place to turn for a look at the week's health headlines. I'm Erin Billups. We begin now with a deadly problem that's on the rise, especially in the Bronx. There's been an increase in the number of deaths caused by overdosing on prescription painkillers. Now the City Health Department is focusing its attention on the borough with a new ad campaign. Representatives are also being sent to more than 1,000 healthcare providers. They're recommending doctors only prescribe a 3-day supply of opioids for acute pain in lower doses, so no painkillers for back pain, arthritis, or headaches. They're also asking providers to avoid prescribing the drugs to patients already on benzodiazepines, medications known to increase the risk of an overdose. Health officials say a similar campaign has proven effective on Staten Island, which saw a 29% decline in deaths in 2013.
We want them to understand that these are drugs that can be dangerous. The right way to think about a prescription painkiller is heroin as a pill, and they should prescribe it to the right patient and the right amount for the right length of time.
According to officials, a New Yorker dies every other day from prescription opioids. That's a 200% increase in the number of deaths over the past decade.